HPV, the human papillomavirus, by Rachel Murray, Emily Olson, Sarah Rhodes, and Olivia Shaw.
Many times, HPV has no symptoms. However, if there are symptoms, it can take weeks or months after sexual contact for them to appear. The most common symptom is genital warts. Even while using protection, one can still catch genital warts because it may not be covered by the condom. This infection can be found in the mucous membrane but also on the skin around the genital area.
The HPV virus is a very small virus that is non-enveloped with a circular, double-stranded genome, as you can see in the picture above.
HPV is a very common disease. Most sexually active men and women will get the disease at least once in their life. However, only a few of the strains are actually known to cause cervical and other cancers. Some high-risk strains of HPV, such as strains 16 and 18, are known to cause cancer. This is due to proteins E6 and E7, which causes host cells to multiply irregularly. It can take 10 to 15 years for cancerous cells to form from these strains of the HPV virus. HPV is thought to cause as many as 70% of cases of cervical cancer. The HPV virus can survive for many months outside of the host in low temperature.
HPV is spread through direct human-to-human contact, which tends to come in the form of intercourse. Because it is most commonly spread in this way, the virus can be found in sexually active individuals. It's extremely easy to spread, which can be seen in rough statistics. Around 79 million people are already infected, and there are about 14 million new cases each year. However, these cases usually have small, treatable results, such as warts. The HPV virus on its own won't kill anybody, but it does have the potential to escalate to different forms of cancer, most notably cervical cancer.
There are a few options for prevention of this disease. The only one that is 100% effective is abstinence, but that is simply not practical. There are two vaccines on the market for HPV, Cervarix and Gardasil. Cervarix is a vaccine used for the prevention of cervical cancer. Gardasil is used to protect against most genital warts and cervical and anal cancer. Of course, with most vaccines, it has room for error. If an individual does decide to engage in intercourse throughout his or her life, having fewer sexual partners will aid in reducing his or her chances of getting the disease. It is recommended to wait 8 months until you are sexually active with a partner because by this point, any HPV that was previously contracted would have cleared up. Additionally, the use of condoms can help to protect, but like the vaccines, will not fully prevent infection. In males, circumcision can reduce the chance of obtaining or transmitting HPV.
There is a large controversy surrounding Gardasil and Cervarix, which are two vaccines that help protect against certain types of HPV. For both vaccinations, the CDC recommends 3 injections over a 6-month period for adolescents ages 11 or 12. Most of the controversy is due to the fact that some parents think that this will encourage their child to have sex at this age. Also, some people have objections to the vaccines due to possible side effects, which have been proven to be false. Gardasil is a vaccine that is recommended for both males and females. In females, it prevents cervical, vulvar, vaginal, anal cancers, and genital warts. In males, the vaccine protects against anal cancers and genital warts. Cervarix is only recommended for females. This vaccine's job is to prevent cervical cancer.
Boys and girls between the ages of 11 to 12 are recommended to begin vaccination. Females who are under the age of 26 should also consider having the vaccination if they have not already done so. And men under the age of 21 should also consider getting vaccinated if they have not already done so.
There is currently no treatment for the virus itself. Usually cases are mild and the infection gradually goes away on its own. There are various prescriptions that are commonly used to eliminate genital warts. Procedures such as electrosurgery and freezing are other options.